Welcome to FixFitness, guys. Episode
What? Is it
10?
Wow. We made
Episode
it to
X.
10.
We made it to 10 weeks.
Yeah. Doesn't mean we have more listeners who just made it to 10, as in we did it.
And like every week, you just fast forward to the second half of the episode for the actual good content.
Because all the shit talking and stuff.
I don't know why before recording we have all these good nuggets. We hit start and we go, and then camera shy. We figure out where our lives are going, and then it swings into a good way for a while, and then all of a sudden the second half takes off. But no one gets there.
It's fine.
It's fine.
Who do we have on today?
Melissa.
Yo.
B.
Hey.
My favorite little bee.
Everyone still calls you Mel or Melissa, and I call you B, and I feel like...
You feel like you're in?
No, I feel like I was lied to or something. That
I've
like,
only called her B forever.
Because then every time I say Melissa or something, they're like, I was like B, and they don't know what I'm talking about.
Yeah, it's, I prefer B.
Yeah, you guys hear that?
Yeah,
So stop calling her Mel or Melissa. And we already have a Mel and Melissa in the gym. So
I get called Ian all the time. No one calls me fucking Cook. Yeah. I like being Cook, but none of my friends call me Ian. But everyone at the gym does, and I've just stopped fighting it. I write it down everywhere now. No
one calls you Doc either.
No, well, every week that shit. Every week. No, we have B. She's part of MBMT. Body therapy, because we're going to go into the stigmas of what massage therapy, manual therapy is, but you are, I've worked with a lot of massage therapists in the past, and B, I've seen start her business from the ground up as a manual therapist from the get-go, never really wanting to be that holistic, relaxation, therapeutic massage, like always willing to get to work, hammer on these athletic patients. Yeah. So she's worked well with our athletes in the past and patients.
Yep,
so
a lot of our CrossFit Sun members go to her. Yeah.
So we'll get into it. B, when did you start MBMT? Because I lose track of time.
Probably the date that I started here, which was my birthday, October 17th, 2 years ago.
2 years ago.
Yeah, so almost 3 years now.
Still in school.
I was still in school.
And just starting out. And B was like, I want to work. Let's get to work. And we just threw a bunch of people at her and said, here you go, sink or swim. We'll figure it out as we go along. Yeah. And we have, right? We've all kind of just figured it out.
Everything's so new, so we're all learning together, you know what I mean?
Yeah.
Like, a lot of this is through trial and error, so it's not like you can find some of these principles or training, like movement patterns in like a book.
Right.
Because we've talked about that. The stuff we're doing, it's like the muscle action versus function or whatever we talked about.
Yeah.
It's you just don't find that. So what we've been doing is really testing the last 2 years as a team.
Yeah.
So
and that's what
cool.
I would say about 2 years ago, we were all have our what Robin Bennett's always called like our silos. You have your health and fitness gym. I have chiropractic. She has massage therapy, quote unquote, and we all needed to work. We all were working together without talking to each other, right? But we were like figuring out like what the common goal is for all of our patients, and that was always easy to establish. So what we wanted to bring B on and talk about was what do you think the role is for massage therapy, manual therapy in like part of a rehab team like we're forming?
I think it's a huge part of a recovery, to find the balance between letting your muscles recover and go back into working out, because a lot of people I've met who work out, you guys love it. You guys do it 6 days a week, sometimes 7, with an active rest day, maybe on a Sunday. And at that point, your muscles don't recover naturally. They genuinely need time to breathe, to recover, to recoup, rest. And
what do you think about, because a big thing with CrossFit, especially in our gym, is we picked up the mobility stuff early. Mm-hmm. So mobility, as in Kelly started stuff with mobility tools. So we do a lot of foam rolling, lacrosse ball.
Yeah.
What's your views on that stuff?
I think it's good in between workouts and visits, whether it's your chiro, manual therapist, acupuncture, whatever. It's good maintenance on your own. It's enough to break up some of the tension, the stagnation, the lactic acid, whatever you want to call it, right after a workout. I would say do it within an hour of your workout just to get everything kind of reflowing,
Yeah.
get it moving again. But it's all going to settle again in the next week. So you could do it daily, but...
That's true, because, like, the big thing when I came to see you was it kind of opened my eyes up, where I remember just asking you about, like, hey, my upper trap was really tight or whatever, but I would just jam that lacrosse ball into that painful knot.
Right.
And since it hurt, it gave me feedback. I was like, oh, it's working.
Yeah.
But we've been doing it long enough where we're like, whoa, it's working temporarily.
Exactly.
Then why the fuck am I constantly jamming this lacrosse ball every single day for hours? Yeah. Because I was, not just for recovery, but I was trying to, like, fix something. Like, my neck was hurting or something. My shoulder's hurting. So.
Well, go ahead.
Go ahead. No.
I was just going to say, I think it's good to definitely do the self-recovery. I mean, lacrossing, foam rolling, stretching, whatever you need to do. Yoga is really great for that. But the difference between doing it yourself and having somebody else do it for you is it's completely passive. If you allow me to make the movements for you, I'll hold your hand, I'll rotate the shoulder while I'm actually working on the muscle. And you could do it with a lacrosse ball, throw a lacrosse ball in and rotate the joint and just kind of release it.
Because if I, like, move my own arm up and down, it's not passive, as in, like, I'm still using muscles to move my arm.
Right.
So then it kind of goes against trying to release it or something, right?
Well, that kind of goes with the theory of, like, the active release technique. So, like, ART. Yeah. Even though none of us are certified in it, we practice some sort of style of it because it's a way of myofascial release where you are activating the muscle through its entire range of motion. And yeah, B and myself have shown people how to do that for themselves at home, because you can actively do it and get a better release of the muscle. But I think it's pretty effective, and I think that's why it's more effective to call you a manual therapist, rehab therapist. We've called you too, because stretching, active release, hot stones. What else? Gua sha, like everything, right?
Yeah, cupping, gua sha, or scraping.
Whatever it takes.
So much people get massaged with feet. You can get a Thai massage where the ladies are standing and holding on bars and rubbing you with their feet and stuff. I mean, there's so many different ways, but they're all functional. It's all for something. Even if you're getting a relaxation massage where you fall asleep and you snore through the whole thing, there's benefits to it. It's just what you mostly need, what type of therapist you're seeing, and what results you want out of it.
Then what kind of, what's your goal as a massage therapist? What's your intent? Like, why do you do it? Or what kind of clients are you, like, mainly excited to treat?
I love treating your CrossFitters. Every single patient is a different
fucked upness
treatment. Yes. That's perfect.
It's true
wording.
though.
It's true.
Yeah.
They're all broken.
We're all broken.
And that's okay. I mean, it is what it is. You guys love what you do, and I learned at the very beginning not to tell you not to do it. When I first started, I would tell them, here's your homework. Don't go work out right after a massage. Give it 24, 48 hours. And then I'd see a post on Facebook 2 hours later of someone
I PR'd my lift.
Yeah.
You're like, wait a second.
Shout out MBMT. I could fire my glutes today because my low back's not tight.
Right. And so I learned at the beginning just not to tell you guys not to do it unless you'll know now if I tell you please don't go work out for 3 hours after. Legitimately don't go work out after. I had someone from your gym who did go work out right after a massage, and he got pretty injured. I'm not saying any names. And
it's got to be.
And it's not a bad thing. But there's a reason why I'm saying.
We talked about it with the pre-Murph and pre-open stuff. Like, it's a false sense of security that I finally have range of motion in my shoulder. I could throw this. Yeah.
Exactly. It's a false sense of range of motion where they're like, yes, and then it'll go back and you might tear a pec. You might.
That's
really
just crazy to me. Like,
something.
After I get any kind of passive therapy like that, I can't do anything physical. There's no way. Like, I just want to go home and
take a nap.
Yeah, but you just got treatment last week, Mark, and went and worked out after, didn't you?
Yeah, it was last week.
I think it was last week. Was it?
Mm-hmm.
Yeah. How'd you feel? I think you got acupuncture, right?
Well, the difference I would say, because when I get a massage or when I get treated, I would do FixFit movements and exercise afterwards.
Right.
Really.
So that's where
smart.
Because the way I see it happening in the big picture, like the whole team approach, is that if someone's upper trap dominant, so like they can't do anything with their shoulder, push, pull, right, without using the upper trap, they're going to work out anyways. So if you come in for massage and then you get the upper trap to release a little bit, it's, in my opinion, a good window to work on like FixFit drills.
Right. Or
even if you're jumping into a class workout, you modify to try to engage the pec or the lat or something better. So I actually use like a massage, and then I'll try to jump into use that like window of like my trap finally turning off to make it better.
Yeah, and I think there's something to that. If I know my patient who's coming in next is probably going to work out after, I do a very sports recovery centered massage. I don't let them fall asleep. It's probably going to be painful. I'll do a lot of jostling, which is kind of where you push them to keep the nervous system awake, so they're not so relaxed. They're getting into that deep Zen massage drunk mode is what I like to call it. So it keeps them on their toes. It keeps their muscles awake. It keeps the brain firing and out of the relaxed mode so they can go without injuring themselves. But I won't spend 45 minutes just on the traps at that point,
right,
which is what I like to do for a recovery. I prefer people come in, if they want recovery, actual recovery, on a day before they know they're not going to work out. Come to me after you've worked out, let me break shit down, and then you get to just rehydrate and let that muscle sit. Yeah.
But that's what you get when you see Melissa, that she listens to what you're going to do that day, the next day, and she's going to tell you a game plan, rather than you have a massage Heights, Zen Spa, whatever, like membership. Yeah, and you just go all the time, and it's like you're kind of just going to get the same thing over and over, and that's where it's a little different here, is that she's going to assess, I mean, what if there's an injury, right? Like, let's say someone actually tweaked their shoulder, tweaked their knee. Yeah. It's a totally different approach than what she's talking about, too.
And I think it's good because it's like a, trial and error, and you've worked a lot of our events. Right. So this is right before a competition.
Yeah.
So we've had talks about this. It's like you need a different approach. You can't completely you can't get a full massage on a certain muscle group around the shoulder and you're about to use it to lift.
Right.
Like 10 minutes later.
Which is why at events I'll do 10 minutes, 10 minutes, 15 max if I know they're about to go out and do the movements. Afterwards I'll spend 15 minutes on it just to keep it going without spasming up. But during an event, I won't spend too much time on one specific area because of that fact. I don't want it to be overworked right before a movement. I don't want it to be too tired from being worked, because that can happen too. It's still a tissue movement. I'm still activating the muscle. I'm just doing it for you. You're not necessarily doing it. So it can still get tired from a massage.
I think that's what's cool, because you had so many of our members come to you, and it's like a lot of different cases, a lot of different injuries or wear and tear, and you know how to work around their CrossFit schedule.
Yeah.
Versus like what you're saying, where what Ian was saying is just you just go in for a massage like once every 2 weeks, and it's like, what is that massage gonna do for you in terms of performance, or how does this relate to your training regimen?
And this is what we say all the time. You come in and get cracked at your adjustment, you go in for your
get a sweat on
CrossFit workout just to get your heart rate up, and then go home, and it's like, anybody in our community is paying a premium for our services, for our expertise in the field, and we're all have that same mentality of like, look, if you want to better yourself, listen to this. Listen to what you should do, take the necessary steps going forward. And people don't, but we are there to do that. And it's like, if you're wondering why B's is so booked up and why our prices are the way they are, it's like, this is why. Because you can't, go pay like half the price and just fall asleep at a massage, but you're not going to get the same results.
That is the biggest issue right now. I'm just going to throw it out there.
Yeah.
You're booked all the time.
I know.
It's proof that it's working, and people like appreciate the extra, right? This is not a typical massage. But yeah, they're like, damn.
Here's the thing. I have two things to say about that, though. I did hire someone to open up my schedule a little bit more, but she's so good, she's booked out by 4 weeks now, too. So that's the first thing. The second thing is, if they made their appointments when they were here checking out with me, it wouldn't be so difficult to get in a timely manner.
So you gotta listen to the homework. Listen to the homework.
And there's two ways of looking at that. or I guess I should say my perfect plan, right, is having someone make a monthly appointment every 4 to 6 weeks, whether you're broken or not. Just come in. Who cares? If you want to sleep. Let me do my work. It's maintenance, it's rehab, it's recovery. In a sense, it's just every 4 to 6 weeks. But also come in before an event or after an event. Come in every 2 weeks for us to really break shit down.
Because they'll need it more for an event. You're going to push harder.
Yeah, you got lactic acid in there that's not flushed out properly.
It's a really big issue for all three of us, is that people don't call us until they're broken.
Right.
Mm-hmm.
And I was, it's like, we have FixFit classes. I've been talking about it, posting videos about it all the time.
Mm-hmm.
And it's like, they're not going to do the exercise until they're like, I can't move my shoulder.
Yep.
Ian said, come see you.
Pain's a hell of a motivator,
I'm
man.
like, okay. It's the shit I've been saying, but it is what it is. Pain's the motivator. And
And it's the same for me. I get a massage maybe once every 3 months, and I'm in pain pretty frequently. Luckily, I did do FixFit with you.
Mm-hmm.
Oh my God, way too long ago. I wish I was able to get in a lot more frequently.
But you're booked all the time.
I am, exactly. And by the time I'm done, I eat and go to sleep.
So technically it's my fault, is all the members going. I referred too many people to you.
Right.
Yep.
My bad.
But it's cool. I forgot where I was going with that now. What did you say?
You said that you're lucky that you at least did some FixFit.
Right. So I can implement that. I can explain to my patients what the benefits of FixFit is. If I can't get them to you, I know it's a patient who's like, yeah, I'm not going to work out. I refer them to him because I'm like, he's great at functional movements. He'll teach you the proper patterns to move in. And for me, even, I implement FixFit in my own daily activities. I can tell you, I can almost guarantee you that my pecs and lats activate before my traps do when I pick anything up. I carry laundry up and down these stairs daily. Instantly, pecs turn on, and I'm like, that's because of Mark.
And that's all that really, it's like, if that's as much as a person needs, and that's what they need. And it's like, we talk about it all the time, Ian and I, is like, we're not trying to get people to like, FixFit's not a program where you stay in. It's not like a sport or a hobby.
Right.
You take what you can from it, and once you learn the principles, I guess, and then you can apply it to your daily life, or how you give massages, or how you carry things, then you're good. Then that's it. That's all you need to do. If that helped you with surfing, then, like your shoulder doesn't hurt.
Right.
You don't have to do anything. It's nice to have like the recovery and stuff to it.
Yeah.
And I think that's where the big picture is, to like remind people that you do the FixFit stuff. And I'm excited to have you on today, because it's like, you can only do so much, but then you're still going to have overuse muscles. So like, let's say you do a ton of FixFit drills, but now your teres are overworked because all you do is teres carries.
Yeah.
But again, it's just like, you need to have a better approach for making sure that you do not overuse like the right muscles now. And that's what I felt. And when I started training again, and then now I'm trying to get back and to get treated more, is because I realized just because I'm using the right muscles, but now I'm doing more workouts, doesn't mean I'm not more like
Still
injured.
broken. Yeah.
Still broken.
Mm-hmm.
So B, what do you do for injury assessment? So from this standpoint of like, I only see people when they're broken, but I actually kind of encourage it. I don't really encourage a maintenance program like my maintenance program would be an active recovery.
Mm-hmm.
Like, you should be working out at this point. And yeah, every 4 to 6 weeks, you should check in with me. But it doesn't, 4 to 6 weeks could turn into 4 to 6 months for some of my patients. And they come in and go like, oh, I'm broken and my shoulders kind of hurt, and I assess it, treat it, and it's gone in like a session or two.
Yeah.
I'm like, then you weren't really going backwards, and you knew where to go, so I'm happy with that. But for you, you preach such a maintenance schedule all the time.
Yeah.
What do you do for injury assessment when they just, do you find it, or do they wait till the last minute? I'm sure you see it all, but what do you mostly see?
It's kind of both. They come in because they're injured. I'll get a text message, oh my God, when's your first appointment? My shoulder is killing me. My glute is not firing, whatever.
Mm-hmm.
So I'll come in on a day off or whatever, depending on how bad someone is. I get them in the room. I have them explain to me what the issue is. I was doing a deadlift and I felt something pull really tight, and now I can't rotate my shoulder. I can't undo my bra. I can't bend down and pick something up. So what I do then, once they're on the table, once I'm actually in the tissues and working and feeling things, I might push on a spot, say it's their upper trap that's actually hurting. I'll push on a tricep and they're like, oh shit, how'd you find that?
Yeah.
And I'm like, well, I know that everything's connected. The whole shoulder girdle feeds into the bicep, tricep, which feeds into the elbow. So you're probably having tingling and numbness in your hands too. And they're like, oh my God, how'd you know that? Well, I just know the body. I mean, that's part of my training, is to know the muscles and the way they move, function, whatever. So it's kind of trial and error in a sense. I mean, I have to feel around. If I feel a trigger point, if I feel a knot, you know.
Well, that's the nice thing about having that time, like that hour or whatever, right? Because they come in thinking like injury,
right.
and you have them leaving like, it's actually not, it's this, tricep issue, let's say, and then they're leaving going like, well, I don't even need to like, you know, go see my MD because my hand's tingling, right? Like they can actually go work on something. Or you can go, if it's a member of Mark's gym, you can say, you should go talk to him about that pec, because I don't know much about what movements you're doing with your pec, but Mark can show you how to rehab that, right?
And I do that at the end of each appointment, especially if it's someone who I know sees both of you. I'm like, do you want me to talk to them, or do you want to talk to them and let them know? Because I'll tell them, you know, go see Mark, go see DJ, whoever you train with.
Right.
Let them know this is your issue, and
it's
have
not
them,
injury, right? Like they wrap their heads around like pain, signaling, get help. Oh crap! Hopefully she can help, or otherwise I have to go get some more, you know,
like a shot or something.
Yeah, I gotta go get an X-ray of it, and it's like, here we go.
Yeah.
You know, so that's nice. I like that. You know, for me, it's like structural. It's like, let me assess your shoulder stability, but from there, you know, you got to move on and go apply it. But for you get to look at the whole muscle anatomy chain for quite some time, which is nice.
Which is cool, because today I spent, it was usually when I book my one-on-ones, it's like an hour, but I usually go an average of 1.5 to 2 hours, because I'm trying to assess movement. That's what I do. And then they move and they're hurting, and then I'm trying to get them to move with the right muscles, and then they get that aha moment, like, oh, the pain's gone. And I think the biggest benefit for all three of us, what we do is then we just give them that like comfort, because when they're hurt, they're in fear, panic, and then you break it down and you give them the knowledge of how their body works and what the pain, where the pain's coming from, and then they're not as scared anymore, and they're like, oh, okay, cool, like there's a big knot in my tricep. It makes sense. Yeah.
Now I'll go roll it out tonight when I get home, or I've been rolling it out, or whatever.
So that's the same thing today. I spent like 2 hours with someone, and it was just explaining him like, okay, it's not as bad, because if it was, but then now like moving forward, I messaged you, Ian. I was like, his erectors are just so guarded. It took me like, usually I give him a variation of a movement to activate like the obliques, and it should be fine. It took me like 3 or 4 variations.
Because there's a lot of injury.
Yeah, so that thing's so guarded, and that's for me, again, it's like the traditional way of doing it, or my old way of doing it, because I didn't have a team of people to rely on. I'd say, oh my gosh, your erectors are guarded, go roll it out, come back. I'm like, and that's what I wanted to ask you. That's not even an area
we like to roll.
Yeah.
That's the thing. We look away from it.
And so, like, I wanted to give him more movement drills, but he's at, like, level 1. I can't even start.
Yeah.
He had to, like, lay fully on the ground, and then I found one variation where he did it without aggravating that spot. So the big thing that I learned, again, where I still don't really understand because it's not my, forte, but if their upper trap, like you're talking about, is super guarded, the general mindset is to grab a Theracane or a lacrosse ball and dig into that knot as hard as you can.
Right.
Because it does feel good. Because that thing there's a trigger point in it. So when you push into that knot, people relate pain when you're digging it out as like pain relief.
Yes, that's huge with me.
So how does that actually work, and why is that not a good thing to keep digging that lacrosse ball into a knot that's so guarded? I tell my members it's guarded for a reason.
Right.
And for me, it's like telling them, like, there's a reason why it's guarded. It's protecting something.
Yeah.
So
it could be a few different things. One could be that the muscle's just so overused that it's you kind of talked about atrophied muscles at one point a few weeks ago, and where the muscle's just not being used properly, or it's not being used at all, so much so that it just kind of quits working on you. And that could be it, where at one point maybe he wasn't working out at all and just on computers all the time, so it was contracted, and it got stretch shortened or weakened or just wasn't firing at all. And so he went into working out and pumped it up huge in a matter of 6 months, and the muscle went from nothing to huge, and it's like, oh shit, now I don't know what I'm supposed to do. I don't know the right way to fire. I don't know what I'm supposed to do as a muscle group. So
it signals pain.
Right. Pain, because it's just like, I need to be released. It's like a water balloon that's just getting filled and filled and filled, and that outer sac needs to be released. The pressure needs to be released on it. So a case like that where you had to try 3 or 4 different techniques to get it to move, fire properly, I would send them to me at that point, because there's something wrong with the trap. There's maybe a trigger point that has a knot on top of it, which might have just extra tension built on it, or lots of inflammation. Or pain could mean that he's not using it right, or overuse. He could be right-handed, whatever. But what I would do for that is I wouldn't just jump in with an elbow. I would start off with 5 minutes of just really light pressure, getting those muscles to relax and calm down, let the nerves chill out for a few minutes, and then get firmer and deeper and firmer and deeper until you can kind of get those top layers erased, so you're deep enough into the tissue that you can push on that little trigger point and get it released. But sometimes it's just so built up, layer upon layer, 20 years worth of carrying kids and groceries and driving and texting and computers, that
it's not gonna shut off with 5 minutes of lacrosse balling. But man, all these deep sack releases is getting Mark excited right now. So we gotta change the subject.
I'm gonna go find a masseuse.
Oh shit! Yeah, let's bring that up. Manual therapy versus massage. What is the difference?
Well, I mean, it
do you feel like? Well, here's real quick.
Okay.
In the fitness industry, a manual therapist would be someone that's like, I have an ART.
Right.
Like Mark can seriously get an ART license and be like, I'm a manual therapist.
Yeah.
I don't like labels.
So massage therapists don't like that. But then I would say, in your case, as a hybrid of everything, you shouldn't be. A manual therapist actually kind of opens up the scope for you, right?
Yeah. When I meet people, I don't like saying I'm a massage therapist, because the first default is they think of a spa with oil and a hot table, and I can do that too. Manual therapy, I think more of ART and functional movement therapy, 5-pound weight versus 30-pound weight to get a muscle to turn on.
And all the active care you give them when they leave, absolutely. It's crazy. Like, you don't get that at a spa, for sure.
Yeah. So those labels kind of mean that to me. Myotherapy literally means muscle therapy. I like that because I'll work a muscle no matter what the issue is. If you want that leg to be relaxed, I'll relax that leg, but I'll work the shit out of your injury.
I started saying rehab therapist because you were stretching a lot of my patients for a while too. I know you.
I still do.
Okay. So she goes through these waves of hey, I just got 3 people in a row go she stretched out my lats or whatever, and I'm lengthening it this way. It's that's a stretch you can't do to yourself. I mean, you can, but when it's passive, like she's saying, you get even deeper release of it. So
there's a difference between what we want people to know. There's a difference between a regular masseuse or massage person.
Definitely not masseuse.
Right?
So masseuse?
I keep saying that because I'm poking the bear. I'm dude, so what's the difference? I think a masseuse, aren't you a masseuse? I don't know.
Masseuse is totally 80s term where you could probably say it to someone who was a massage therapist in the 80s and they're like, yeah, I'm a masseuse. Oof. For the younger therapists, at least of my day, masseuse legit means HJs, happy endings, and all of that.
So you do want a masseuse.
I heard you're open late.
Right? You're open at 10 p.m. with a red light on outside?
Ooh,
for sure.
Yeah, stay out of those.
Yeah.
And you were saying the Thai ladies walking on your back. Yeah. I've had some bad experiences with that for my patients.
I went to, when you go to the mall or the fair, those, shout out to my peeps, all my Chinese uncles and shit. Yeah. It's always
the chairs.
Full of old dudes.
Come over here. Come over here.
$4.
Yeah. They fucked my neck up once.
See?
Because it was after an event and the kids and Andrew were shopping, and I'm like, fuck it. I just need some recovery.
Yeah. Take care of myself for once.
Good thing he wasn't masseuse, because I'd be sore everywhere.
Yeah.
Wow.
Yeah.
his name was ringing in our head. Our friend Rick, he was first time coming in to me at an old office, pain down his arm from one of those shops, man.
Seriously, like
numbness, tingling, like where he is.
Like they probably impinged something.
They impinged his,
beating down, because their whole idea is that if you feel pain in the knot,
good.
It's working.
Yeah. People want it. They're like,
they do want that.
I don't want deeper. I want harder. And it's like,
people do talk about that. They have like, you go to this place, I'm gonna step on you and crack everything, and I'm like, well, I don't know if that's like
I don't know if that's safe sometimes.
Yeah, I used to try to explain that to people, especially my big, huge lifters and whatever. They're like, no, like I want hard, deep tissue.
That is a big thing for me coming into it too, where it's like when I got a massage from you, it didn't feel like what I was used to for a lacrosse ball, and you had to explain to me, tell me why it's happening, because then or else I'd just be like, wow, that was like half-ass massage, that fucking sucked.
Yeah,
dude,
not coming back.
Our old jiu-jitsu buddy, with red hair, the first time I met him too. Yeah, cupped his entire back and pained down his arm too. Yeah, couldn't turn his neck the next day. He got a refund and shit. They were scared of him afterwards because he was like, "What the hell? I can't even move now."
Yeah,
they cupped his whole back.
They cupped his whole back,
his entire back.
That's
because he went in with a stiff upper trap, and he was like pissed.
Yeah,
and he was like, "Can you help me?" I'm like,
more is better."
I was like, "Damn, man!" Like, yeah. So, don't. I've worked with massage therapists in obviously only in medical settings, and that was like the first location I was at. I think I said masseuse, or like an old patient of mine said masseuse, and she got so
really.
Mad.
I didn't know that.
It's like disrespectful.
Yes.
Yeah.
I thought that was like the
it's like calling
professional term,
like a flight attendant calling him like a stewardess. You know, it's like I don't know if that's the right word anymore.
Hey, see, it's good for people to know so you don't fuck up.
Yeah,
because I don't know.
Well, she went to school. She's well trained. She's a business.
How do you differentiate the like vacation or we're talking about like massage envy, like just buy a packet and you go in whenever.
Yeah. Like
how do you differentiate? How do you look for a massage therapist? Or what were you saying, manual therapist?
Manual therapist.
Is that, doesn't everyone just label that? Or do you have to have a certification to be a manual therapist?
Not necessarily.
Or massage therapist?
I mean, there's different certifications you can get. You can do a lymphatic drainage, oncology training. I mean, I'm going in June to a seminar to learn specific hip type of techniques.
Oh, that's right. You're showing me that. It looked cool.
Yeah, so I mean, there's different things you can get certified in. Massage therapist is very broad, just like any chiropractor you can go to, but one chiropractor might do the tuning forks over your head. One might do allergy testing by an egg bracelet, or one might do functional movement training and teach you how to use your proper muscles. It's very broad. And, I feel guilty hating on a massage envy or any specific spa
I think they do different things though, right? It's not really
it's Swedish.
The thing is, you can get a sports, you can get a Swedish, you can get a hot stone, a prenatal, whatever. The thing is, it's not consistent. They don't give you a set routine. A lot of people who come straight out of school go into a place like that, so they're just learning. Your body is a new canvas for them, so they'll just do Swedish. You tell them, look, it's really my traps and maybe my scalenes up here are really bothering me, my neck is hurting in the front, and they're like, yeah, for sure, we'll work on that. And you still get the 60-minute or 53-minute routine where you still get 3 minutes each on.
Do they train you that in school? Timing in and out.
Yeah. So that's a good way to look out for, right? You're like, that's about like 3 minutes on my quad, 3 minutes on my calf. Son of a bitch.
Yeah.
I'm getting the standard.
I think it's so funny because in our school they don't train us any kind of etiquette kind of stuff, like until you get to business. But I've asked massage therapists in the past, like, do they teach you like 53 minutes, so that means like you're killing time in the beginning and the end, you don't get the full 60?
Well, for me, what I was trained as is you want that 60 minutes is your paycheck. So in 60 minutes you need to get them in on the table, get the treatment done, get them up and checked out, because I check people out myself. I don't have somebody, unless Cassidy has a minute and I'm really busy, she'll hook it up and be like, yeah, go do what you have to do. But in 60 minutes, I have to have everything done. And then I have 10 minutes to get my next person in and going.
So it becomes the business. They do teach a bit of a business model and etiquette stuff.
And so, people get mad. They look at the clock and they're like, oh, wait, that's not 60 minutes. But it's like, well, the 60 minutes includes getting on the table, the assessment, yada, yada, yada. But that's why spas have signage at the front. It's proper to tip your therapist $20 for a 60-minute massage. Also, please note that your massage might be a 50 to 55-minute massage.
Yeah, there's
to
so much.
accommodate.
I know, it's a crazy world.
Different world, I guess.
Yeah.
I don't even think about all that.
And what to do if any tents get pitched, you know?
Oh, God. It's so...
Little banana hammocks start
it's
poking
natural.
out.
Look, you
Address
guys,
it.
there are
I'm not
certain
saying
areas.
names.
There are certain areas that you might touch
Guilty.
lightly or something, and it'll happen. If it does happen, dudes generally are embarrassed when it happens. Like it's like sitting in a classroom. Hey man, you never know. I mean, it's like when guys are teenagers, it just happens. You guys are like, oh shit, let me put my notebook over it, whatever.
That's true.
In the treatment room, there's no notebook to hide it with, so we're trained in a professional way. Like, you just should have it draped anyway. That way, if something pops up, it's covered. You can't see it. You don't notice.
Dude, this is a real thing. Now that
Yeah.
she said that, I do remember in school them telling us, your hands go onto another patient's or another person's body.
Mm-hmm.
Yeah.
You instantly have a different connection than someone that's just sitting here talking like right now.
Right.
People may have not been touched for like 30 years and you touching them and it's like it's weird for them.
It's true. It's got to be weird for some people. I mean, I can see that.
Yeah. And there's a ton of stuff like that.
Yeah.
People wearing inappropriate clothing, you gotta like learn how to get a towel, like all this stuff.
Yeah, saying inappropriate things.
Yeah.
And
I'm so lucky that I have not had someone pitch a tent while I'm doing FixFit for them.
Not yet.
Not yet, but...
Oh, what about
it's 'cause
farts
they all wear
during
those tiny, tiny shorts that hold everything nice and tight up. To
I
the
get
leg.
farts on adjustments and,
Yeah.
and people always ask like, do you laugh? And I'm like, well, yeah, like the first couple times I've laughed, or later I'll laugh.
Yeah.
But during I'm like,
Dude,
I literally don't even think about it.
Some people don't care when they're in a massage. They're like,
They fall asleep?
This is freestyle.
Till they
I'm
fall
gonna do
asleep
it
and a
all."
fart wakes them up.
That happens too. Oh my gosh, I had this huge guy.
Here comes the professional
He's
side.
like 6'4",
Uh-oh. If you're
like
6'4".
super professional guy.
Yes.
We'll talk later.
Yes.
Super professional dude, just knocked the hell out. I'm like up on his hamstring, like elbow into the glute hamstring tie-in, and I'm like, yes, I feel the release coming.
Yeah,
Wrong
you did.
Release, dude, right in my face. And he was
Pink
slept
eye.
through it.
Pink eye for a week.
He slept through the whole thing, and I was like, cool, fucking cool.
I always if I fall asleep in acu or a massage, I do a shake when I wake up.
Yeah.
Have you done that? And like your whole body
No,
does it.
I have too
and I'm
much-
always like, what if one squeezes out?
I have too much anxiety to fall asleep in a room.
Yeah, same.
There's no way I would fall asleep. I just couldn't.
I talk.
Oh,
I'd be
man.
like, okay, if there's too many things that could go wrong if I fell asleep.
Dude, you've heard farts on oblique openers. Firing the cord real
Yeah,
tight.
for sure, all the time.
And peeing themselves.
Oh, that's...
Not usually on jumps, like jump ropes and stuff. Oblique
Onto the floor.
openers does help with that, though.
It does help.
Yeah.
Firing those external obliques will get rid of your pee.
So,
Pee problems.
going back to the main question again.
Oh, yeah.
Cool.
I don't
Sorry.
just keep talking about this. This is way better.
I love getting off topic.
No, this is a great topic.
This is what we do
I
at
am
lunch.
definitely.
Toots
I'm
and banana
definitely.
hammocks. Yes.
This kills our day.
Everyone else is just like listening. Fuck, did I fall asleep and pitch a tent?
Am I gonna be a topic on a
Shit.
podcast?
Remember, it's okay.
Yes.
1 in 4 men. It happens to everyone.
Yeah.
You definitely will be a topic. No
If
one's
you're,
safe.
if someone's looking for a massage therapist, one, now they know that there's there's different approaches, right?
Right.
One's more, I guess, custom, personalized to that individual's needs. Like, oh, my shoulder hurts. I need to work with someone on the soft tissue
Right.
because I can be adjusted and stuff like that, and then I can do movements to help. But something's just gummed up. I need soft tissue specialist, which is you, right? Again, how would you find someone like that if that's your goal?
I would super research. I mean, you can still go to a chiro office and talk to their massage therapist, and you still might find someone super, what I like to call hippy dippy, all about energy. And you know, you're like, no, I was just in a car accident. I just want like this to release. And they're like, yeah, we're gonna do some Reiki. Cool, that works for some people. My massage therapist who I hired does that kind of stuff. So word of mouth, Yelp, read reviews on people, ask the doctor that you're working with what type of therapist they have, because there's not a lot of people who work as closely as we do.
Yeah,
they
that's
just
true.
rent a room out and they do their own
Are there
thing.
questions that I can, like, if I'm looking for a massage therapist, is there questions that I could ask? You know, like, can I go like, hey, my shoulder hurts. It's a chronic injury.
I always say ask for, like, if
but
my patient's moving.
Massage Envy, they'll throw me to a sport massage and then they'll just do a harder massage.
That's a chain though, right?
No,
but that's what most people think in terms of when you get a massage. It's like, hey, I got a cool gift from, Christmas. It's like
I had a thing real quick about the getting a gift card stuff, or can I go get a therapeutic one? I've had patients go, like, don't tell B, but I got a Mother's Day gift card. I might have to go to Massage Heights, and I'm like, no, definitely go for it. You're supposed to go relax. Your family wants you to, go enjoy it.
B
and
doesn't want to do that to you.
Right, and B doesn't even, B's too busy anyway. But then they come back and go like, oh, that sucked.
Yeah.
It was like 30 minutes or whatever, but like they come back and go like, I need to see her for real now.
They laughed at me when I pitched a tent. It was so awkward.
B doesn't laugh at me. So
B doesn't laugh at me.
No.
She just puts a pillow on and walks away.
I'm a one-woman man.
It's like probably 9 times out of 10, if someone goes somewhere else, they generally come back to me. And that's not a big head thing. It's because my technique is so different. I will implement any technique I need. You might get a hot stone and a hot towel, but then you might get some cryotherapy with a cold stone after some deep tissue. My techniques vary so much depending on what you need.
Never had
it.
So good.
We'll get you.
Melt your muscle down.
I got to sign up for 2020.
Right.
How's your 2020 looking?
I don't know.
September.
You're a hard dude to get in on my treatment too. But I would clear a day to get you in.
And then do a live video.
That's a lot of banana hammocks. That's probably like one every hour.
Just like after the podcast with Brittany is like experiment. Let's stick all these needles in everywhere. I'm like, oh my gosh.
Interested.
Like, pincushion last time.
Yeah.
It's fun though. It's for science.
But when I've done that with Brittany too, like let's work on this, or I've seen her or Erica for like a shoulder real quick. I'm still like, even for like one area real quick, I gotta go home and go to bed now. Mm-hmm. So tired after.
Yeah.
Like I get
especially because that muscle is just so built up with tension. It's guarded. It's tired. It's inflamed. So getting work done on it, your body's telling you, fucking take a chill pill and go to sleep for a little bit. Let it relax.
Yeah.
So it's
nice to finally get it to release. It's like my body doesn't know what to do with itself. I don't know how people go work out, but if they can, if you can go hit a FixFit type workout after you finally get that release, that is the proper time to do it for sure.
Real quick, go back to like what questions you should ask to find the therapist. I personally wouldn't ask for a sports massage depending on where you go, because like I said, if you're going to one of those general spas where a lot of the time it's someone who just came out of school, our sports massages are 15 minutes that we learn in school. It's literally like a quick jostling, like this type of
loosen
movement.
Up the tight muscle.
You get the blood flowing, you get the nerves awake, because they're supposed to jump straight into an athletic event within 30 minutes, maybe 24 hours after that.
So that's the sport massage that most people are
gonna get. And they're like, you can leave your clothes on because we'll just do some movement over the clothes. And that's cool. It's great. That's what I do at your events. Like, you don't have to take your shirt off because you don't need to. But that's what you'll get for most people. Now you'll get some people who are like me, who I'm like, yeah, let's do sports. My sports is way different than someone who
you tell them to look for deep tissue then?
See, it's so hard.
Yeah.
Deep tissue, some people think you have to do deep tissue to the full body.
Yeah.
And
then they're wrecked.
Yeah, and then they're wrecked. Then you get the flu-like symptoms. They're out for 2 days. They're like, oh, that jacked me
Been
up.
there. That sucks.
And, you feel great afterward, but your whole body, your gastroc might not have needed an elbow to drag through it, where your trap for sure did. You know what I mean?
Yeah.
So it's about jumping from therapist to therapist until you find one that works for you. You can ask them, like, if my pec isn't firing, what would you do to get my pec to loosen up and fire?
That's the shit I asked you from day one all the time, and I still do.
Yeah.
And so.
And your pec's still not firing. It's crazy.
They're working perfectly broken.
And so for you, like what I would say is I'd release the pec, we'd get into the anterior delt a little bit, release some of the scalene, maybe get into the lat to help that whole section open up, de-guard it, whatever we need to do.
Here's maybe a good filter for massage therapists, because I remember, I don't know if you do this for everyone or it's just that because of the FixFit connection or whatever, but I remember the first massage or two, you were explaining what you were doing, because I wasn't there to fall asleep or whatever, so we're having a conversation. So that was really cool.
Yeah.
So I don't know if that was just because we were talking
She's
shop.
big on anatomy. I've seen her pull out anatomy books and be like, this is the muscle I'm talking about. This is
I
the
love
action.
when they fight with me about it. They're like, no, actually, I don't think it is that. And I'm like, okay, let's pull out the book. There you go. Point to me.
It's important because I think majority of the people nowadays understand that a massage therapist is important for training and recovery. You need it as part of your training program. So most people are coming in to fix something, to improve on something, right? So they're the ones that you're probably mainly going to see, or else everyone's going to go bargain hunt and just get the feel-good massage for like 10 to whatever, $30.
And even if they're still doing that, honestly, there's still benefits to it. It's still affecting your lymphatic system, the circulatory system, your respiratory system, the nervous system. It affects everything in a massage. Even if you just go home and your wife rubs your neck with lotion for 10 minutes, you feel 10 times more de-stressed because it's actually doing something. So it's not necessarily a waste of money if you go just get
Whose wives do that?
I was like,
I offer all the time.
What the hell is this?
I offer to my wife, and she always is like, no, it's fine. No.
Okay.
So
that must be nice.
that must be nice.
come over. Come to my house. I'll massage your neck.
So I guess Mark asked earlier, like, your ideal client is somebody that's actively working, ideally would, no bias to the podcast, but doing FixFit movements to help themselves. But what do you, what's the like mission statement of MBMT? What do you see as a manual therapist? What are you looking to grow with? What's your clientele? What do you talk to with patients that don't work out at all? What are their treatment plans like?
So when they come in, I'll talk to them, do you work out? What type of activities do you do? Oh, I carry my baby all the time. Oh, I'm on a computer all the time. I don't go work out after. Okay, great. So I'll go over whether they need to see you guys or Brittany. I will try to teach them. If they're not going to go see you, I'll let them know what muscles to activate for a movement so they're not re-injuring the trap every time or re-injuring the Achilles or whatever it is. For them, it genuinely depends on each person, really. If it's a mom who wears baby all the time, it's probably going to be traps and neck, and we'll work on that, and I'll teach them the proper way to squat to pick up the baby and put it over the shoulder versus bending forward and doing that. We'll get them on a maintenance plan because those are the ones who really need to come in frequently.
Yeah, they can't escape baby.
Right.
You can work out less, but baby's there all, and I know it's like all day now.
Yeah, all day.
So there's no
24/7.
You have ideal clients that you work with, but there's no limits to who can walk in the door, who you can
because
fix.
it's all different. Every single body is different. Even if you both have trap pain, it's probably a different issue for each of you. It doesn't matter. No matter what the body is, it's
I know, it's
different.
like I'm deadlifting 500 pounds and Ian's deadlifting like 135.
Okay.
And we both.
I deadlift 20. We're good.
There's a CrossFit total on Wednesday, Mark. You going for that 500 yet, or what? How much more time you need?
I need a lot more time. So a question for you then is your goal. Yeah. What are your long-term goals? Do you have because what we're trying to do, Ian and I, we're trying to change the game. We want to help other trainers, other CrossFit gym owners, chiros, anyone, because we're doing something that's different in terms of approach. It sounds like, the question I asked, how do you find a massage therapist like you, and that keeps running into like, well, you really can't right now.
Yeah.
And if that's the honest truth, that's the honest truth. So is your long-term goal to be in, like starting to hire more people to teach or massage therapists your way? Like, where are you at? Or you're just kind of content just growing your empire, being busy as hell
a little bit of both. I brought someone on to free up my time to go get more training. I love learning, so as much education as I can get out of it, I'm going to take. So I have someone to cover those hours that I can actually leave town for the day to learn. But also, I'd like to get people in to train them how I work. I just don't have the time for it right now, because if I'm not here, I'm doing something for work somewhere else or family. I mean, I've got to balance the two because they're both equally important. This is my baby and they're my family, and so it all goes together. But I would love to eventually have maybe a second location where maybe just the people who want relaxation or just the maintenance could go to that location with someone who just deals with a maintenance routine, and they come to me specifically, or a head therapist that works next to me
on the unique cases,
right,
or something that's more severe.
This is
like
why
injuries.
it's so easy for B and I to, like, we sit down and meet maybe 3-4 times a year business wise, and just talk like this, because I think like probably like 6 months ago she was like, I'm going to bring someone on, what do you think? I'm like, that's a great idea, because then she wants to free up her time just like that. And I'm like, I say the same things, like, I want another chiro to do the cracking and stacking, and that people need it, but at the same time I want to be that injury assessment person to know this is broken, I need it fixed.
Right.
What do I do? What's the treatment plan?
One adjustment's not going to fix this case.
Yeah.
Right. Yeah. So B definitely can grow her team, and I think another site for like you said, just relaxation.
Yeah.
There's a huge market for it.
Yeah,
It's crazy.
And even the relaxation stuff doesn't mean like there's still a more efficient way to do it,
Right.
Right.
than the general massage you can get. So
Exactly. And it's I'm very particular about the people I work with. I won't just work with anyone. I think I'm very fortunate to have literally been thrown into the lap of you guys. I mean, if it weren't for the two of you and Brittany, I don't think I'd be as successful as I am. You guys have meant a lot to my business, to me personally, to my growth, and I appreciate you and thank you so much. I'm so grateful for both of you.
finally, that's why we brought her on.
Yeah,
she finally fucking thanked us.
It took an hour, man.
Jeez.
Damn,
I
geez.
think that I'm also a big believer in the universe and energy, and
Oh, here comes the feel-good
as medical
stuff.
and rehab and recovery
The
as I
hippie
am, I'm
stuff.
super big into like my essential oils and all of that.
Oh yeah, we got to talk about CBD lotion.
Before we
Yeah.
talk about
Oh.
CBD, but it's since you brought it up, we're trying to build that team. You know,
Yeah.
that's why I asked that question a little bit, because we do want to spread this message of like FixFit, because it's enhanced my CrossFit coaching and gym.
Right.
Your chiropractic practice, and for you too, you just started, but your business is booming
Yeah.
because of the fact that
Yeah. It's a mentality, that's why, and that's what she came on the podcast to show you what the mentality is, because if you're in maybe like a couple years in a treatment with you might not think you're even going through that, but people that listen to it will go, oh crap,
because the
that is how
industry
it is.
so like you said, it's all about, there's signs about the minutes and this, and I never even thought of that, but I can see that it's like you're trying to book your calendar up, get as many people in and out, and it's like
I used to be that way when I first started.
because that's what you were taught,
Yeah. When I first started here, I was balls to the walls. The second I was out of school, I was here 7 days a week.
Yeah.
I was seeing 7, sometimes 8 people in a day, killing my body to help people get better.
It's that
We look back on those numbers sometimes and go, whoa.
Yeah. I mean,
Whoa.
Yeah, working
What were we doing
12-hour days
Yeah.
for at least me, not functional for myself. I was dead at the end of the day. I couldn't work out anymore, and I wasn't eating properly. I started gaining weight just because I was so busy taking care of everybody else, but also trying to build my business. If I didn't have the space, that was someone walking out the door. And for me, it's not even about money. I genuinely care about these people. Like, I shouldn't, but I'll text people and say happy birthday. I'll text someone and say, how's your mom doing? I know she had surgery 2 weeks ago, or, whatever, because I care. And so when I'm telling you, like, no, please don't do this, or for sure go do that, I mean it. There's a reason behind it, where other therapists, once you're gone, they don't give a shit about you. They're like, they left me a $30 tip. Cool. They care about tips. Your treatment with them.
Yeah, those people in spas are stuck like it's a job.
Well, they work on tips, dude. They get paid like $17 an hour, which
that's crazy.
You get almost more at McDonald's. So you just went through school to make good money, make a career. Now you're stuck somewhere where you're making $17 an hour. And
to me, it's the creative aspect too, right? Like if they're like, patient walked in and they're signing in on the computer, signed up for Swedish. I do Swedish today, and it's like there's no creativity to that at all. There's no let's sit down and talk about it first. It's boom, in and out.
It's like crazy. That investment in helping people, and I think that's what's important. You're thanking us, but it's mutual, where we all came together because we all have that same goal. We know that our industries are kind of fucked up. Like it's not working. We're not helping people the way we promised, or we got into our industries helping people. So as much as you're thanking us, we all have that same mindset. We're trying to invest our time, instead of just taking every single certification under the sun. We've taken a lot of them, but we really lean on each other and ask each other for help in terms of like, hey, does this? I ask Ian all the time about these muscles, and I talk to you about it, and that's the benefit. And it takes someone's personality to be open to that, because you're part of the team because you didn't have an ego.
Right.
It's not that like, you guys don't know what you're talking about. You're a CrossFit
Let me
trainer.
fix it.
Like, get the hell out of here.
Yeah, don't go back to that CrossFit stuff. It's bad for you.
Yeah, don't get adjusted. That doesn't work. It's just like, it takes a unique personality type to allow that to like, okay, just because I teach you how to move doesn't mean I know everything. And so you became part of the team because of that fact, and that's what's so special about it. So
I think people want to buy into that, but they're scared to take that leap. And like for you, like you said, you didn't really take a giant leap. You just went, I got to do it 7 days a week. I'm gonna grind through it, and we learned together and grew together, which is awesome. But some people are just, if they're stuck in some kind of a hamster wheel, like I said, no creativity throughout their day.
Right.
That's when they have to take the huge leap.
I'm guilty of that too, though. When I first got out of school, I knew Swedish, I knew some deep tissue, I knew a little bit of hot stone, this and that, whatever. So in a session, I'd be like, yeah, okay, let's do this. And it would be a Swedish, and I'm like, no, I'm not happy with the treatment. I'm giving, what can I do to better this? Other places, and this isn't all, when I'm saying other therapists, other spas, whatever, it's general. Not everybody's that way.
Sure.
But for me, I just feel like when you go somewhere, you pay a price to get what you want out of it. Other places charge $10 extra for a hot stone. I did for a minute because that's what I knew. And I took that away real quick because I was like, no, that doesn't work.
You're not about the extra service. It's like you're helping them.
For deep tissue, if an hour treatment is $60, they'll charge you $90 for a deep tissue 1 hour, because it is a lot more work, but you just pay one price.
Yeah, I did the same thing with the Theragun. Should I charge 10 per session? I'm like, no.
Yeah.
If you need it, you're going to get it. And then you did the same thing. You're like, should I get a Theragun too for my... And I'm like, yeah, it's a really effective tool. So you're constantly learning, constantly evolving. And that's what's fun about being your own business, is that you can have the freedom to go do and try it and error and evolve. Yeah. I'm going to work less hours. I'm going to work more hours.
Right.
That's part of the
higher
growth.
Quality versus just more people.
When I first started, I wasn't growing as quickly as I financially needed. So I really thought about getting a second part-time job at a spa. And I was like, super easy, not going to hurt my body as bad because it's just the basic whatever.
Yeah.
I went to the interview. And I was like,
I gotta get the fuck out of here.
Oh my god, they just asked me about weekends.
And there's some people who love being in the spa.
Oh, sure.
It works for them, and they're great at it. And
some people love just showing up, doing their thing, and
that's cool. I'm happy for them because I can't do it, and I will gladly send the people who want that to them. I'll tell people, I'm not afraid to say, I am not the therapist for you.
Yeah.
I'm sorry, this is nothing against you or me. Let's just cut ties and you go to where you need, because I don't think I'm it for you. And I think that's big too. I know people who hate the people they work on. They're like, I can't fucking stand this person. This lady drives me crazy, but it's money. And
it always goes back to the red carpet treatment.
Yeah.
It's just like, it's a red carpet to walk in here, and we can rope it off anytime we want, because it's like, we're busy enough to where it's like, if you're not going to buy into the system and whatever that is, quote unquote, it's more of the philosophy, the lifestyle. And it's like, if you don't like what we're doing, you don't want to buy into it, you think it's a waste of money, time, then go somewhere else. It's completely fine. It's not going to work for everybody.
Yeah, it's just like, for me, you get the red carpet when you come in, but if we don't vibe, if our energy doesn't match, or you don't like the treatment, you're like, my last therapist didn't do it that way, then I'll try to move it around. We'll see what works, right? We've got to meet somewhere. We've got to compromise. Yeah. But after 2 or 3 sessions, if it's still not there, I'm not mean about it. I'm like, well, you don't want to work with me, so no. It's just kind of like, we don't. We just
had it last week. We just had a patient last week where me and another therapist was like, man, that chick said she's done here and like moving on. We're like, thank God. Yeah. You know, it's like, you don't want that negative energy coming in. You're
not going to give a good treatment if you don't like them, and they're not going to feel good leaving if they don't like you. So mentally, what's the point?
Yeah. Off of that point, it's kind of like, I think good advice for people that are just in our fields, respective fields, is that you have to kind of, like, a good filter is that you have to be able to, like, say that you can't help them. Yeah. That's huge, and I've told you guys that too. It's just like, I can do what I can do, but I have to be able to tell a client saying, hey, that's you fell on the weekend, something happened to your back. I can't help you with that. And it's scary for people that are just starting a business or working, because they want to kind of like bullshit
everybody.
No, come here, I got you. I'm like, bro, you could have, I don't know what the fuck's going on.
It's like you were saying, 7 days a week, I got a slot.
Exactly. So that's the number one thing is, you have to admit that you can't do it all. Right. And that's where our team is so successful, because that's how we kind of bonded. It's like, I don't know this, I'm going to ask for help, or I'll refer out. That's okay. Right. You're not losing a client by telling them I can't help you further than this point. They're actually going to respect you more because you're giving them truth.
And they might refer someone to you because they're like, oh, you don't like this one? Maybe go try this one, because this is what they told me.
Yeah, that's super important. And maybe that could be a filter to find a good massage therapist, is that if you're asking for help with these muscles that are super guarded and doesn't work a session or two, if that massage therapist refers you out and says, hey, you know what, maybe try this or go to see that, because I've done everything I think I could, and now go maybe try this or try that, get cupping or get, try movement. I think that's important, because then they don't bullshit you. Oh, you know what, I'll try these other massages. Give me like 5 more sessions.
And that's what I love about our office, is now that I've hired Mona and Erica's been here, there's 3 massage therapists that you can go through to find the right technique for yourself. I mean, I have no problems giving one of my patients to Erica or Mona. I'm like, no, if I'm not working, try one of them, because they're just as good in their own way. Erica, I've been massaged by, and she's great. I feel great. She knows her shit. She's been in the game a long time. And she knows what she's doing. As hell,
And but not a masseuse.
Not a masseuse.
Hell no. No, she's always been like, I do ART. Don't be that. Don't the person that we discharged was like, I don't know about that therapist or whatever, and she was like, come back, like, I'll drop the hammer on you if you need it. She's worked on charger players. She's worked on elite athletes. Like she knows what she's doing. But no, I always learned working in a multiple disciplinary setting from basically my whole career was that when you are able to refer out, like Mark's saying, you add more validity and credibility to yourself, actually. So if I'm, I guess, not smart enough or man enough really to be like, I don't know, you need to go talk to this person, that adds credibility if that person that you just referred to is saying almost the same thing, but with their technique. And it's not like we're trying to, this patient's mine, I'm not going to share it, I'm going to fix them. It's like everybody's like trying to fix somebody. So you actually add validity to what you're actually doing instead of...
That's important, because that's the trust, the relationship that takes time to build. Right. And, it's something that, like, you're just fearful of losing that, like, client. Like, if I'm a CrossFit trainer and you got hurt, most people would try to, like, mask it by, like, hey, try this stretch, try this mobility tool. Versus I would say, hey, you hurt yourself, you should probably go see Ian, see whoever. Because the whole reason I would tell them to do that is because I care about their well-being. Exactly. Versus me trying to, like, oh, fuck, I'm going to lose another member. Well, how am I going to pay bills? Because that's normally the thought process.
That's a lot of still common.
Yeah,
of course, because then you don't want to be like, oh my gosh, you hurt your back, you're going to be sent to a chiro, and then you're going to tell everyone about... It's like, no, I just care about your back and I don't want you to be in pain, and let's fix this.
Right.
And there's some weird thing about like protective, like my clients.
Yep.
Oh no, they're gonna keep seeing Ian or keep getting like it just it doesn't make any sense because we're not taking the client's best interests at heart.
Yeah.
And that just I think that's where we're all on the same page, and that's what makes us different.
The FixFit movement.
Yeah, I like it.
And same with like anyone that's a trainer, massage therapist, you'd probably be open just chatting with them, right? If they're just coming up.
Yeah.
Maybe, I don't know.
Yeah, I will talk to anybody about their body, someone else's body. I'll show them things if they're not aware what a muscle is, what the function of a muscle is. I'll talk to them about it.
Should we have Mark take his shirt off and we could talk about his body?
Go for it.
On Power Belly?
I'm into it.
I've been eating a lot. Let's go into, since you brought it up and I stopped you on that.
Oh yeah.
The CBD.
Go into the hokey stuff here.
Okay.
B is a hippie, so let's go over that.
Yeah.
She went to Sedona, recharged her chakras and moonstones.
Yeah.
I
Brittany
really
did
believe in that.
The stones. I didn't charge my
While she was at charge the stones?
She's better about charging the stones than I am. I'm more about like walking barefoot in the dirt and like
Grounding.
Grounding. Yeah.
I just grounded Caleb today because he had a little fever.
Oh,
dude, I think that shit's real.
He's the cutest thing.
There's got to be something to it.
Yeah.
I posted that on my stories, and then I got like 4 or 5 messages saying, "What? He's so young. You grounded him already?" I'm like, nah, okay.
It's legit. I mean, I definitely believe in energy, and that's kind of how you were talking about earlier. You put your hands on someone, it becomes a different environment than just sitting across from someone. Yes, there's physical touch involved, but there's chemistry involved. There's energy being shared, and it can change.
Transferring of energy too, right? Yeah.
Yeah. That's why.
That's real stuff.
I don't do Reiki. I don't do energy stuff like that. But Mona does, and she has people get results from it, whether it's in their mind and it's a placebo effect or
a lot of it has to do with the stress and nervous system, so you can get them to relax because the chemistry's right. Well, shit, it works.
And they'll call that placebo because they can't measure it.
Yeah, exactly. And that's cool. I believe in certain aspects of it. So yeah, I'm a little bit hippy dippy. My treatments are just a lot more rehab, recover, medical, but I do implement essential oils. I'll use some lavender to calm someone down, or if they have a migraine. Or
have you started using CBD oil lotions?
Yes.
Oh, real quick,
that's cool.
Can I chime in? Marie got told once by a lady that because Marie got a lavender spray, was it? Mm-hmm. And they were like, "Oh yeah, I put that on our pillow." Marie's like, "I was spraying it on our pillow before we go to bed or something," and this lady was like, "That's gonna make your husband gay." And Marie started laughing. And she was like dead serious, like staring back at her.
Where was this at?
Well, I can't say.
Oh no.
But I came back and told them, and I was like, "You guys better not be using that lavender essential oil around me. I'm gonna be gay in no time." It's
that was wow.
Yeah.
Dead serious.
Yeah.
And I was like, "What is that? Where would you even get that kind of info from?" So Marie's like, "Oh yeah, she just bought a new lotion recently. I like put it on my legs before we went out," and I was like,
"Is that lavender?"
"Is this lavender?" She's like, "Yes." I was like, "Oh my god, I'm gonna come home with a man. What are you doing to me?"
You're gonna be looking at different booties tonight.
Oh Jesus. No, but yeah, go on. Sorry, lavender.
CBD.
You better not be using that on me while you massage me.
So if I use CBD on people, they're gonna leave potheads.
Oh, there we go. Yeah. So I was telling Mark, the CBD market with the weed plant on it is not selling as well. So they're all rebranding themselves and. Yeah, CBD. I get asked twice a week probably by patients. Mm-hmm. What do you think about it? Mm-hmm. I just got asked recently too for competition. They don't know how to regulate it yet.
So I would recommend for anybody, and I have people who ask me this all the time, what do you think about CBD for events, competitions, sports events? I tell them don't do drops beforehand because you'll probably get sleepy. I mean, it's not getting you high.
You're getting mellow versus being amped up. Yes,
exactly.
And
super
adrenaline.
Chill, which might be good for nerves, but everything's just going to be slower to respond.
The question I got asked was, would they get tested? And I was like, there's no THC in it. So I don't know what they would test for. Right. And he was like worried, like, is there THC coming? I'm like, how pure are they? It's like it depends on where you buy it.
That federal employees, there's a certain test that they get for like the cannabinoids, like the CBD aspect. They can test for that now. Yeah. So like firefighters, cops, and stuff. I don't know how true that is. that's just down the
I don't
grapevine
think
of what I've heard.
topically or with the drops it's enough, right? So
I don't know. The drops, perhaps, because some of them recommend 2 full droppers, which could be like
2
0.5. Yeah.
we
2
got to have a
milliliters.
CBD episode, I think.
Yeah,
or
like a legit one.
with like a scientist, like Mark was saying. But real quick, your CBD lotion that you would use on a patient.
So
how do you go about that? Consent, obviously, right?
Yeah, they have to be of age 21 years old and consent just because legalities.
Yeah.
But
doesn't smell?
It does.
Oh, it does?
Some, not like weed, but it smells like mint.
Usually it's got some menthol in it.
Mint, arnica, and those help fight the inflammation and pain too. Arnica, you can go buy a tube of arnica and rub it in and you'll feel
patients actually like
pretty
that.
good. Yeah.
Biofreeze.
Right. So the CBD, you can get warming CBD, you can get cooling CBD like a Biofreeze or something. It fights inflammation, helps calm the nerves down, the pain receptors calm down.
Good results right now. With people like rubbing on their elbows or neck before bed. Yeah. They get good results.
I have someone who uses it because his knees hurt a lot after CrossFit.
I'm just gonna vape
he puts
it.
it on his knees.
I'm gonna vape it all the time, bro.
I'm not a vapor. I can't do vape because I'm scared of my lungs. Like, I feel like anything entering the lungs that's not oxygen.
You look cool and you get less inflammation. I'm gonna vape.
Yeah, you can make circles and arrows and make a balloon animal out of it.
Yeah.
What do you tell people about Bengay Tiger Balm?
It's legit.
What are the patches?
Salonpas.
Salonpas works. They feel good. I mean, if you're about to go on an 8-hour drive and you have low back pain, throw one of those puppies on because it's going to feel good.
So here's what I tell them, because they'll come in and be like, I just put on Tiger Balm or something. Mm-hmm. I learned in school Bengay, which my whole high school career was putting that on my back to make it feel better, that is actually just a skin irritant. And then your brain perceives skin burning. The muscle is actually not getting anything.
Yeah, that makes sense too.
And then I was like, oh, shit. So then like Tiger Balm, Bengay, and there's another one, Icy Hot. They all do that, but then Biofreeze actually has a component that will go a little topical. Mm-hmm. Arnica, a little more topical, meaning that it will actually get into the muscle a little bit. You think? But CBD is hands down the best one.
On that topic, if I tweak my back on a deadlift, right, my lower back is blown up, what would be the ideal thing that you'd recommend as like one of your clients for treatment? So if I tweak
with CBD,
or just anything, should I roll it, stretch it, put CBD oil? Like, what is what would you tell them? You know, so if I texted you and I was like, man, I blew up my back, I can't come see you for a couple days and can't come see Ian or whatever. They're just like, I just kind of want some a speedier recovery. Like, what would you tell them to do? Like,
well, I would
ice
ask,
bath or
like, is there swelling? If there's swelling, maybe for the first 15-20 minutes, go ahead and throw some ice on it to stop the swelling. Let it swell for 20 minutes first. Then put some ice on it.
Smart.
To let it stop the swelling, the vasoconstrictor, and let that stop. Yep. Then implement heat, because that will bring the fresh oxygenated blood to help start recovering the tissue or whatever the issue is. Rest, and then try some functional movement patterns after the fact. Let it rest.
Some light stretches.
Right. Yeah. And if it still hurts in the movement, stop movement, apply more heat, and kind of feel it out.
Yeah.
Then I would refer them to you guys first, depending on if it's like spine or if it hurts when they're moving.
Yeah, they're moving the wrong way.
Or not moving.
That sounds good, because that's the same thing we'd say.
Epsom salt bath with olive oil.
For sure, Epsom salt bath.
What does that mean? Epsom salt bath with olive oil and
I don't know.
Something else? So then you're greasy and salty when you get out. Maximum effectiveness.
Your maximum effect. You will definitely leave the bath.
Yeah.
I get sent that because I say Epsom salt bath all the time.
I say Epsom salt all the time because it's good.
I've even had patients take a hot towel with Epsom salt on it because they don't want to get in the tub, and they rub it onto their back, and they're like, it freaking helps.
Yeah, I have a few patients who don't have tubs. Yeah. They just have the stand-up showers. So I tell them, take a hand towel that you have in your kitchen, get it super hot with water, throw some Epsom salt, get it wet again, and just like throw it on you like a heating pad.
As long as the salts go into your system, it should reduce inflammation.
And who knows, right? Like you're saying, the Tiger Balm might just be a skin irritant, and the bath might be you're feeling better because this is the first fucking time that you've sat in a bathtub.
And that's what I say.
Well, there's some scientific research behind the bath, though.
Yeah.
If you follow Rhonda Patrick and know their research.
They're really trying to get on Ron and Patrick to like.
MBMT now. Hey, Rhonda.
Oh, dude! If you guys have Rhonda Patrick on here, whew,
if we have Rhonda Patrick on here, we're doing something wrong.
We're not smart enough, dude. We can't hang with her.
Dude.
We're the
she'll
black
dumb
sheep
it down for you.
We're the black sheep of the industry, let's say.
No, yeah, she talks about heat shock proteins a lot, getting your body under extreme temperatures. I tell patients too, just like you said, you finally just laid in your tub. I'm like, don't take your phone in there, don't take a book. Exactly. 10, 15 minutes of silence in there. And it's like, that's probably even better for your nervous system to get away from that shock.
Yeah, you're in parasympathetic, you're rest relaxed finally for once in the...
You get out of fight or flight, get into that parasympathetic tissue repair, and the Epsom salt's getting into your system. It's good.
Now that we're talking about it, that might be the reason why people recover faster when they see us. Because when people are hurt, when they're injured, they're afraid. Yeah. So they're in fight or flight for many days now. They're like, oh, my career's over. I can't play golf. I can't CrossFit anymore. I might have to have surgery. And then, so they never get to recover.
Right.
So how big of that plays into the role of recovery? And then we see them, we're like, to me, I'm like, okay, move this way. Ow, it hurts. Move that way with these muscles. Oh, the pain's gone. They immediately have a sense of relief, and same with you guys. So I wonder how big of an effect that has when they finally get into that rest, relax, or,
It's huge.
Oh, tremendous.
It's crazy. Because they're so lost. They're looking shit up on WebMD.
Oh,
yeah.
They're all
they come in and think they have throat cancer.
Yeah. Everything led to, I have elbow cancer, I swear.
Yeah.
Can you check this nodule back here? Do you think it's moving?
I'm the worst. Andrew will tell you I'm such a hypochondriac.
No, you don't know how bad it can get.
Yeah,
we see way worse.
I'm pretty bad though. Like I'm close. I feel like some of my patients who are really bad hypos make me feel better about myself because I'm like, oh, thank God.
I'm not that crazy. Just a little crazy. Yeah. You're way worse than I am.
I've had acid reflux for 4 weeks. Have you heard of Barrett's esophagus? That's a cancer, right? I'm like, you were on Google, weren't you? Get off of it. Yeah, I had one guy who was watching surgery on it. On YouTube, and I was like, you've had it for 4 weeks.
Yeah.
And you haven't been to a doctor yet. And then he was watching, he's like, they stuck a camera down the throat and took out all this esophageal lining. I'm like, I can't even believe you could say that word.
I had an issue with my stomach recently, and I was very afraid I was going to have to get a colonoscopy. I won't let someone put me under, first of all.
It?
Dude, I did all the research
on it. Don't YouTube it.
But listen, I did find some good stuff out. If I ever have to get one, which my doctor said I don't have to.
She's justifying her crazy rabbit hole.
You can get them without being knocked out. And people who have got them without being knocked out say you don't even feel it. It's at first you're just like, oh, that's interesting. And after that, you're like,
It's just like videos of birds.
Shay's worse than me, I think.
Yeah. Oh, yeah, dude. I'm pretty bad.
That brings up a good point where someone with this kind of pairing up a couple episodes, it's hard to get treatment, or hard for me to go to you to get treatment, because if you're not accustomed to getting massage, there's a lot of weird barriers, like anxiety for one, right? You're going into a room and you're uncomfortable, you barely know this person, you have to get pretty much naked other than your underwear or whatever, and then now you have to lie face down, and you're forced. This is like the biggest fear for a lot of people, is to sit still. So now you're telling them to lay down like naked, head down, and people freak out about that, you know? So do you have a lot of people that are afraid to get a massage?
No.
Well, they probably just never show up. Like,
You've seen teenagers too?
Yeah, I see teenagers, kids. 13, 14. I've worked on babies before for like upset stomach or constipation, stuff like that. So there's dealing with nerves is a big thing. What I find, because I'm very anxious, I'm a very anxious person, meeting someone new or going into a room alone with someone, I am someone who can't go face down first. I request in all of my own massages, I ask my therapist, can you put me face up first, please? I
learned that because I toughed it out the first few times because I didn't want to look like a bitch and all that stuff, right? And you just didn't want to make it awkward. Yeah. But it was so much better because I was like, you know what? I just can't breathe through my nose. Yeah. You know, I just need to go face up. Yeah. I'm not comfortable.
And that's cool.
And it was like perfect after that.
For me, I have no problem. If someone tells me right away, like, I have anxiety, I'll bust out the gay lavender scent and we'll gay you up a little bit.
Damn.
And, you know,
I never
I'll
got
ask.
that.
Changing lives.
I'll ask them, you know, are you comfortable? If not, I can turn the table warmer off. We can turn it on. Do you want to flip over. I ask questions if I realize someone's anxious. But what's even better is if someone's vocal with me and tells me about it. Because I didn't know
if you're
your
listening,
first treatment.
Yeah, I didn't say shit. And that's where most people, they overthink things. That's why they have anxiety. So if you are thinking, if the only hurdle is that you're anxious about it or uneasy about it, just talk to the massage therapist and tell them straight out.
Yeah.
And it'll make that experience a million times better.
Way better.
Because once they know, it's like, cool, I have things that I can do for you.
Yeah.
I don't have, this is supposed to be a relaxing 53 minutes. And then, but if you are, anxious and you're just nervous the whole time, you're probably, just tensed up.
And it's good for the therapist too, because maybe they're stuck in a rut in their own routine and they're bored as shit with their day because they just did the same 4 massages back to back.
Yeah.
And then all of a sudden they have someone who's like, I don't want to be face down this time. Why don't you flip me over? It teaches them to be on their toes.
Did I ever tell you the story of the therapist that I worked with? She just got hired, and then when she rage quit. Did I ever tell you that story?
Tell me, please.
So we got a brand new therapist at my old office, and we were doing like those stupid Groupon things, and the patient kept complaining that it was too cold, and then we're like,
what was too cold? The room?
The room was too cold.
Okay.
Yeah. I'm uncomfortable. I can't relax. And she was face down, and I remember another therapist being like, "Tell her to go face up," and she was like, "No, she doesn't want to." She's like, okay, this is in the appointment. So she's coming out of the room. She comes out of the room like 4 times. She comes out and says she doesn't want to go that way. She comes back out and is like, do you guys have a table warmer? And they were like, no. Put more blankets on her. She's like, no. She comes back out. We had heat packs, those hydroculators, putting those on her. And the lady's like, she's not getting warm. She's getting frustrated. So I think that therapist was like having like a panic attack as her first massage.
Yeah.
Oh, that sucks.
That does suck.
That's
it was not meant to be.
The patient just left and didn't talk to anybody, just walked straight out. No joke. The therapist comes straight out after her too and just never came back.
Wow.
What happened was they both had an anxiety attack.
They both left.
And they probably have residual issues from that day still.
My boss was calling her like, where are you? You just left in the middle of an appointment.
Because both
never heard from her again.
Both of them probably didn't even know what was going on, but they're having, both of them simultaneously having a full-blown
oh my god.
episode 2.
And then I'm in the corner laughing like
anxiety.
an asshole. I thought it was hilarious.
Because you don't know what's going on. They don't even know what's going on.
Yeah.
They just like, I have to run.
And if you're expecting a relaxing massage and you're freezing, it's not going to happen. Like
that lady was not good at calming her down, right?
Yeah.
Because she's freaking out too.
Yeah.
Yeah.
Poor both of them.
Yeah, that sucks.
Oh, that was the topic to talk about for a long time.
And you're laughing.
And I'm laughing. I'm like, this
asshole.
is great. And then I can hear my boss like come by all serious. Like, I can't get a hold of her.
Yeah.
I guess she's going to leave the key out under the mat tomorrow.
Poor person.
Yeah, that sucks.
That does suck. Now that I know.
I wonder if she went to a spa after.
I bet she'll never massage again because she'll be so anxious that she'll just like.
Not again. I lost another one.
I lost it. The table will never be warm enough.
I mean, people talk about like, walking out of a job at like if you worked at Nordstrom Rack or like, you worked at Chipotle or something. And you're like, I just quit one day and never showed up. I can never imagine doing that as a professional health.
No. Oh my god. I mean, there was a minute where I've thought like, is this what I want to do forever? Like, can I handle people?
Yeah.
Because I'm working with so many different people in a day, and everybody's personality is so different.
You have to stop and think. Like, oh, I should enjoy that there's a new challenge every single day. I do that inner dialogue all the time.
Yeah. Yeah, if I have 2 people that are back to back the same thing, I get kind of bored, and I'm like, start looking at the clock, like, is this one almost over yet?
Yeah.
Oh, the day's dragging.
Yep.
But
that's anybody's job, right?
Yeah, for sure.
You get into the swing of things, but the beauty of our jobs is that we get to, well, let's try something new today, or a new issue popped up or whatever. So
I'm interested to see how many therapists listen to this, and they're like,
no, I want you to send.
They're not gonna like me much.
Send it out. I always wonder that too. I didn't hear any
negative
pushback
stuff
on my what did I talk about? The pressure points.
I was
fibromyalgia. I didn't hear any feedback, so that's good.
They just walked out and never came back.
People are just never gonna book that again.
I was a difficult student at school, and my teacher did not think I was going to be successful. He talked so much shit to me, like.
Probably because you challenged the system a little bit.
Oh, constantly.
Right.
Constantly. He hated me. And he would always throw out little comments on the side like, you know, good students succeed and bad students fail, and if you fail at work, you fail at life. And I'm just like, oh, okay. And I knew he was talking to me. He put new quotes on the chalkboard every day, right about me, like all these negative things. I'm like, whatever, dude, it's cool. I was injured because I worked at a coffee shop when I first went into school, so I had tendinitis so bad it went up into my neck. I mean, it was bad. I couldn't do anything with my arm for a long time, but I needed to graduate. So I had a doctor's note saying I could only do like 2 massages in clinic and whatever. He thought I was faking it and straight up pulled me aside and was like, look, if you get me a doctor's note saying that you can't do this, I'll just pass you. You don't have to do clinic. You don't have to do anything. And at that point, I was already working here. So I was doing massages at school and then coming here after. And then I'd get up to go to work at 3 a.m. to the coffee shop and be done there by 8 to go to school. And it was just a circle, right? So I was tired. I was overworked. My arm hurt. And now I think about everyone in school who was like, that idiot. She's never going to go anywhere. She's not going to do anything. They're going to listen to this and be like, what a bitch.
I was like, B's hired.
Yeah.
Challenging the system, not getting along with authority. This is great. You fit in well.
I try to share the message with other people that are like coaches or something. Like, don't you want to differentiate yourself than the masses, right?
Yeah.
And if you learn kind of like this FixFit approach and just reword it, make it your own. That's what I told you. Even starting FixFit, I was like, you should just call it whatever the hell your like Cook Chiro system, because it's so much different from everyone else.
Yeah.
And that's kind of the benefit, right? It's like, wouldn't you want to change things up, try new things, and so don't follow that standard template of just like clock in same massages every single day, or teach same CrossFit movements with the same style all the time. It's like there's a million of those people out there.
It legit works. I'll bring up JP. Hi, JP, my mother-in-law.
You're on YouTube on her home TV right now.
She'll be watching it. I implemented FixFit with her. She was coming in doing the pre-covery, and before her knee surgery, she was seeing a personal trainer, and she kept saying, you know, my neck and shoulders are really hurting. So I asked what movements, and it's all overhead lifting stuff, and immediately when she moved her arms up, I watched her traps turn on, but nothing else turned on. And I was like, oh, you know, if you fire your pecs and lats, your traps are automatically going to turn off. There's just no way for them to turn on if these are activated. So taught her how to do it. She went to the next couple workouts between seeing me, came back, and she's like, they always turn on now and my neck is fine. So it's a legit thing.
And that's like what we're trying to get across. This message is like, you just added so much value for that person instead of just continuing to drag this person along and saying, oh, it's still tight, we'll come back a couple more sessions. Oh, it's still tight, come back. And it's like, okay, now you've been seeing this person for like whatever 20 sessions within a year, their neck is still tight, and you keep trying to find some like BS way because you're not sure what's causing it. It's
and
crazy.
That's the thing, is you're working together with someone. So I might still ask for them to come in for 4 sessions until I say you're probably going to be pain-free for X amount of time or close to pain-free, but they're going to be doing something for themselves. They're not going to just be expecting me to fix everything. If I teach them to move properly, they implement it, and now it's part of their own responsibility.
You really just pay for the time and the education, really. Like, the therapy itself.
I realized that today. I worked with someone for 2 hours and I kept telling them, it's like, my only goal is to teach you and help you find what's wrong so you understand it. The rest is up to you. I mean, I'm going to guide you along the way. I could give you exercises. But usually what Ian and I tell people is that, like, okay, when you're driving, when you're standing at work, when you're sitting at the desk, I cannot stand and watch your sets and do that crap. You have to do it. And if you don't, no one can lie to you and say, oh, do these magical exercises. No, you're sitting at your desk, you're driving for 2 hours or whatever. That's way longer than you'll ever work out. Those exercises might take you 15 minutes. Even if you did an hour of it, you're standing on your feet, you're sitting at a desk for 8 hours. And it's, again, we're just educating people. And that's what I think I'm starting to realize is, like, if you do a one-on-one with me, I'm just even more upfront, or have the intention to say, hey, we're just trying to figure out what's wrong, so then you're not as scared. We don't have to tell them that, but once I prove to them, And then afterwards, it's like, it's really on you.
Yeah.
You know, and if you want to come back for more education, and if we have to fine tune more things, like that's what you guys are doing now, right? Yeah. It's like for Ian, exactly. It's like he doesn't want to do that. Hey, come every month. It's like if something starts to flare up, and then like, oh, I've tried the teres carry, I tried firing my obliques, but something's different because I'm lifting heavier, I'm running further. Then Ian will want to see you.
Yeah, the goals change. I like seeing people when their goals change, not the repetition,
right?
The hamster wheel thing of like, no, just
and it's not like
old shit.
And people might fall off. Like for me, I was going to FixFit. I got too busy, couldn't go anymore, and kind of fell back into my bad posture during a massage and whatever. When I catch myself now, I go home and I do what is that thing you had us do? It's like you squat with the 10-pound weight ball.
Yeah.
Squat, pick it up, catch it, and fire obliques when you're like sitting back and lats or something. Anyways,
whatever that was, it's working, right?
Yeah.
Well, I feel it.
What it does is it teaches me to engage my glutes and obliques again, and then my lats and pecs turn on, my traps turn off. And then if I do it for a week, my body posture's perfect again at work until I quit doing it, and then it falls back. But
and that's the whole process, is that you're not coming for a quick fix, you're coming for knowledge, and you never stop learning.
Right.
So that's why things change and it evolves. Or if you come in with this new weird shoulder thing, it's going to take some sessions, but it's going to take as many sessions as you put in the effort. Some people I see once, like you come to a couple classes and now you have like skills that you can apply. Some people, it's like more of a unique case, and then we have to see them more often.
Right.
But none of us want to be like, all right, I want to see you like one-on-one every single week for the next whatever year.
Sign up for this package.
That's the last thing I would want.
It doesn't always work, because then they start relying on you. There's no responsibility on them. I had a patient who was in a car accident, and she was seeing me every week for like 6 months or something, because that was part of the plan that we didn't know to cut it off at a certain point yet. And for her, it was just always on me. If she didn't feel good that week, it was my fault. If she had pain, it was my fault because I didn't get deep enough or didn't stretch her enough or whatever. And I finally had to learn, like, no, I'm here to like supplement your recovery, whatever it may be from. Like, you're recovering from surgery, working out, sitting at a desk, whatever. I'm here to help you. I'm not here to do it for you.
That's a good, for like a newer person in our respective industries coming up, that's a great point. You have to be okay like explaining to them, if you really want to help them or have that talk or that change, it's like, you have to do this stuff.
Absolutely.
I don't want to sign you in, lock you into this year contract or program, and every time you come to me and it's like, I'm here to fix you.
Right.
If you do that, that's never going to end well.
Yeah.
Because you're not teaching them anything.
And you have to sit at a computer because that's your career. You're at a computer for 8 hours a day. How am I supposed to fix 8 hours of the same stagnant contraction?
Exactly.
Like, what can I do for that? Yeah.
They gotta want it for themselves. Yeah.
That's the hard part, but we're that's what these podcasts are for.
Yeah, the lighthouse. Podcast is a good lighthouse, right?
The lighthouse
get
analogies.
The info out.
I try to I was thinking about calling a FixFit lighthouse.
I like that.
But I took this from Julian from StrongFit, and is like he had such a new way of looking at movement, and he's getting in all these online debates with physical therapists, doctors, you name it, CrossFit trainers, Olympic weightlifting coaches, and he's like, I'm tired of it. Like, we're just a lighthouse now. And what he means by that is that they're not trying to be the Coast Guard to go out and save people. They're just here. They're shining a light for people that need it, that are looking for it. But they're not there to come and fight a battle and argue with you that, hey, your way is wrong or my way is right. And if what I can do to help, then that's perfect, But it just stops a lot of the
We play
BS.
our part, and then it's up to them to...
It's very easy for us to go, like, I just see all this shit on Instagram, and there's so many little professional conversations I've had with a few people, a debate, and I'm just like, this is a lost cause.
Yeah.
Like, why am I spending time doing that? I could spend the same time making a video that might help like one person, versus doing this mindless debate on who's
on
right.
someone's mind that it won't change anyway.
So I kind of like, I did this recently. I just, I started a new channel, so you have to kind of play that game of liking and following others. I unfollowed like a huge majority of people, and then I'm just, instead of focusing on reading, like watching their stories and stuff, I'm just gonna throw out more content. And it's just because the whole point of that page is to help people. So
it's so important to me that you do that. I appreciate it so much because I don't have time to get into your classes when you're doing them. So when I watch your stuff, it makes so much sense to me. I can implement what I need to, not use what doesn't apply to me, and because I'm not deadlifting right now, so that doesn't matter, but anything FixFit where I can use it, I do. And
that's good to know.
Yeah.
I have one follower.
Yep.
One real follower. The rest of them are sending me DMs and saying, get the fuck out of here. Or do you want to sponsor this and this and that?
Speaking of sliding into DMs, what's your Instagram handle be for all the listeners?
At MBMT_SD on Instagram, and MBMT Body Therapy on Facebook.
That's a good one to have, Facebook, because you posted a couple times now in the past month or so. Like, I have an opening.
Oh, yeah.
I have a last minute thing.
Yes.
You want it, and it works.
Yeah.
It helps me, too, because I would be, like, scrolling on Facebook on my own, and I'm like, well, that's good to know. I can't pay attention to everybody's schedule, so I'm like, all right. Yeah. I know a couple people I could throw your way, so.
Yeah. Definitely.
What was one on Facebook again?
MBMT Body Therapy.
That's
or you
page.
Can just look up Melissa Baramendi, my name.
Yeah.
And I'm always reposting MBMT stuff.
Cool.
Yeah. Hit me up.
That's it, I think, Mark.
Yep.
Mark's on FixFit at Cook Cairo. FixFitness, guys.
Give us a message if you guys have questions, especially if you're a massage therapist, not a masseuse.
Not a masseuse.
A chiro, a trainer, an athlete.
Yeah. Just
let us know. We can help.
Time flies. So. Yep. All right, guys. We're out.
Peace out.
Peace.
Thanks for coming, B. Oof, we went long.
We're
Dude,
out.
did you guys